What is downstaging in pancreatic cancer treatment? Imagine a tumor that seems impossible to remove because it's grown too big or is tangled with vital blood vessels. That's often the case with advanced pancreatic cancer. Downstaging is a process that can change that story. It involves using treatments like chemotherapy or radiation to shrink or limit the tumor's spread. The goal is to make the cancer less extensive so that surgery becomes possible. Surgery is the only way to potentially cure pancreatic cancer, but only if the tumor can be completely removed with clear margins. In pancreatic cancer staging, doctors look at how far the cancer has spread and whether it involves nearby blood vessels like the portal vein, superior mesenteric vein, or arteries such as the celiac axis and superior mesenteric artery. When the tumor invades these vessels heavily, it's usually considered unresectable at first because surgery would be very difficult or unlikely to succeed. Downstaging aims to reduce this invasion by shrinking the tumor or limiting its involvement with these critical structures. This process is often called neoadjuvant therapy, which means treatment given before surgery. It typically includes chemotherapy, sometimes combined with radiation therapy. The idea is to control the local disease, reduce tumor size, and make the cancer more manageable surgically. After completing this therapy, doctors use imaging tests to see if the tumor has shrunk enough to be removed safely. This reevaluation is essential because treatment effects can sometimes make it tricky to judge the true extent of the tumor. Although downstaging is not very common, studies suggest that only about 6% or fewer of patients with initially unresectable pancreatic cancer become candidates for surgery. It can be a game changer for those who respond well. Patients who do undergo successful downstaging and subsequent surgery often have better survival outcomes than those who remain unresectable. It's important to remember that this process requires a team of specialists, including surgical oncologists, medical oncologists, and radiologists, working together to plan the best approach. While downstaging offers hope, it's not guaranteed and individual responses vary. The key is personalized treatment and careful assessment at each step. In summary, downstaging in pancreatic cancer treatment is about using preoperative therapies to reduce the tumor's size and extent, especially around vital blood vessels. This can turn an initially inoperable tumor into one that can be surgically removed, offering a better chance for long-term survival. Always consult with a healthcare team for personalized advice and to understand the best options for each individual case.